The World Health Organization, WHO, has launched new guidelines for key populations. We have brought together existing recommendations across the whole organization that are relevant to these populations when it comes to HIV, hepatitis, STI, but also TB, mental health, substance use and substance dependence. Quite unique for WHO is that we have worked very closely with communities of key populations when we develop these guidelines. People who use drugs, sex workers, men who have sex with men, and transgender people.
You know, this was the first time that values and preferences research, and particularly community-led values and preferences research, was included in the guidelines development process, and so that was just such a significant achievement, I think, for all of the key population communities involved.
This is also what I think makes this report or this update very special, is that it's actually informed by the key populations themselves. The work was done by us, by ourselves, and that makes it really unique.
Values and preferences have always been critical to WHO guidelines, and for us it was really important that the structural barriers are now up front in these new guidelines, because the criminalisation of our community has significant impact on our ability to access services, but also to have a quality of life. So we welcome the structural barriers being up at the front, and in particular the recommendation that governments should work towards the decriminalisation of sex work.
Some of the findings that we had from the values and preferences research that we did, we found that people were uncomfortable going to their clinics when it was revealed that they were gay, or if they had a non-conforming gender performance. So people were effeminate, they felt stigmatized in the clinic and would stop going. We also found high levels of discrimination throughout our communities. People talked about having their sex partners extort them, or being worried about using mobile apps to find sexual partners. And these are real issues that we face, and we can't go to the police. As you'll hear from my colleagues, stigma and discrimination is tightly linked to how law enforcement criminalizes us. Stigma and discrimination prevents people from getting meaningful access to healthcare, from quality healthcare.
Based on the values and preferences research, one of the key recommendations in the guidelines is to address violence and human rights violations.
Some of the specific outcomes for trans and gender diverse people was that a lot of trans people suffer from criminalization of our identities, or the lack of legal gender recognition in different regions in the world, as well as that we have a lot of access barriers to healthcare in general. And something that I would like to mention about the values and preferences update is that this project was driven by community. This project was driven by the key populations, and makes it very special. This makes this update or this report very special, and this is also what we need. We need community empowerment, we need capacity building in communities to actually do the work ourselves, or being involved at the high level, and hoping that this is also going to be driving us into the future.
What we wanted to know was whether behavioural interventions which used a counselling approach changed people's behaviours in order to reduce the incidence of HIV, hepatitis and STIs, and what we found was that they did not. But I think it's really important to understand that there's lots of other types of counselling that can happen with and for key populations, which may have benefits. What we were looking at specifically counselling which aimed to change people's behaviours, like needle syringe sharing or unsafe sex, and it seems that they don't have an impact on those behaviours.
These new key population guidelines are very important for rolling out evidence-based public health viral hepatitis services in key populations. The first additional and new recommendation suggests that people at ongoing risk for hepatitis C infections may be offered retesting for viremia to discover active infection, and the frequency that is suggested by us is that this has been done 3 to 6 monthly. The second recommendation that is new is as well a recommendation for people at ongoing risk of hepatitis C infection, and suggests that they are treated immediately for recently acquired infection, and this implies that if a person has a recently acquired infection, the provider suggests not to wait for spontaneous clearance, but offers hepatitis C treatment immediately.
Another recommendation which we included in the new guidelines based on the new evidence review relates to service delivery model, and it's about peer navigators. So peer navigators are recommended to support members of key population to start HIV, hepatitis and STI treatment and remain in care. So it's important. Their role is to help people to enter health system, to navigate health system and stay in care. They have to be, they must be properly remunerated, trained, recognized, and provided whatever support to fulfill their role. And also it's important to remember that peer navigators are often very highly valued by their peers.
Another recommendation we have, it's a new recommendation for WHO, is related to virtual or online interventions for key populations. We looked broadly at 3 types of interventions: case management that's provided online, targeted health information, and outreach to find new key populations and bring them into services. What we found was that all of these interventions were as good as standard of care or non-online interventions, but they have lots of benefits, such as being more accessible, more affordable. It's important to that this is just an additional choice, not a replacement of face-to-face services.
Also, another health area we addressed in these new guidelines is chemsex. And chemsex is actually associated, or might be associated, with several health risks, including HIV, hepatitis and STI infections, mental health issues, and overdoses. Although we conducted a systematic review, we couldn't identify specifically interventions that help to reduce risk associated with chemsex. But we issued a good practice statement which involves that, which says that chemsex should be addressed through integrated, person-centered and non-judgmental services, which might include sexual reproductive health, mental health services, overdose prevention, and linkages to evidence-based prevention, diagnosis and treatment services for infectious diseases.
Apart from the policy level, where we need these guidelines to be implemented, they are also provide directions for health professionals, ministries of health, donors, civil society, in order to prioritize the most effective interventions.
So the Global Fund's preparing its new guidance, funding guidance materials for the next funding cycle. We're just finishing those off. And in the HIV prevention section of the Global Fund funding guidance, we really emphasise the WHO key population guidelines as a kind of foundation technical guide for the things that the Global Fund want to fund in the space of HIV prevention for key populations. So it's a kind of a fundamental resource really for the funding priorities for the Global Fund.
We have always found the normative guidance from WHO on how to address HIV amongst key populations an incredibly useful and important tool in our advocacy for human rights. We've also used the WHO guidelines in our domestic advocacy in Canada when we've gone to court suing our federal government because they were denying access to sterile injection equipment for people who use drugs in prisons. This kind of evidence was key to our bringing enough pressure to bear on our government that eventually they announced they would introduce a prison needle and syringe program, one of the few in the world.
Of course, now the challenge is to get these guidelines to be implemented in countries and to work with all stakeholders towards including these guidelines in national plans, in the national response when we talk about HIV, hepatitis and STIs.